Hi, I'm Seth Rankin. I'm a general practitioner from Wandsworth Medical Centre, which is in central Wandsworth. My practice has 14,500 patients, and we've got a range of patients, as every general practice does. And as we all know, the entire Western world is getting older. Not only is it getting older, but health interventions are becoming more expensive. And we need to be able to identify the people who need the care the most, and we need to be able to shift resources around to devote to the people who need it most. And most importantly, we need to find ways of helping patients to be more in charge of their own conditions. It's a very common conundrum in general practice. It's the ones that most need our healthcare are the ones that we just don't know about, are the ones that sit at home quietly, getting worse and bouncing in and out of hospital and really not being looked after well at all. We chose to work with Sollis because we need information about our patients. The Sollis Clarity software provides doctors and other healthcare professionals with the ability to be able to identify those patients that are becoming at increased risk and be able to provide them with the resources, both professional and in terms of self-management, that is going to help them to be able to stay happy and healthy at home for as long as possible. And this really just enables us to be able to find those patients and help them. And that's why most people went into medicine. The benefits of the Sollis product are really quite wide. I mean, the main thing about that really is that it has so much information. We chose to use Clarity Patients because it draws data from more sources than most other risk prediction models out there. The software takes information from primary care, it takes information from hospitals, from secondary care, and we're hoping in the future to perhaps take information from social care. And it uses an excellent tool within it to assess that data. It uses the Johns Hopkins ACG model, which has been a very well proven, very effective way of assessing risk in patients. Now, what the Sollis software does, it enables you to have a percentage risk. So we can look at a patient, for example, and find out that there's perhaps a 75, 80%, perhaps even up to 90% and higher risk that that patient is likely to be going into hospital over the next 12 months. Basically, it enables us just to be able to get a list of patients. For example, those who are likely to be most at risk of admissions, which is something that every clinical commissioning group and indeed every patient is very interested in. It enables us to know ones that are being most expensive in terms of how much medications they're using, and enables us to help rationalise. It also uses primary care data in a very creative way, which is very interesting for general practitioners. We're able to see how much the patient is using general practice time as well, because a very important part of modern general practice is managing your internal resources as well. And Sollis Clarity, or Clarity Patients, enables you to do that. The Sollis value proposition is together putting you in control. And it does do that for GPs. As a GP, it's really important to be able to have some control over the resources that you have, some control over your ability to be able to look after patients in the way that is best for them and is best for the whole NHS economy, which is something very important to all of us. I would absolutely recommend Clarity Patients to other practices.